In the beginning of the pandemic, there was a lot of talk about antibodies. If you had them, were you infinitely immune? Could they be the key to helping others fight the virus? The short answer to these questions, scientists still aren't sure, but they're starting to get a better idea.
We do think that this is not like the measles infection, where once you have the antibodies, they're going to last you for the rest of your life. This is certainly one of those infections that you potentially could catch twice, especially if the virus is mutating.
Nine Health expert Dr. Pyle Coley says preliminary data suggests that antibodies after a COVID-19 infection may fade away within a few weeks or months. There are some caveats, though, like the severity of your illness and the strength of your immune system, but still.
There's really a window that's been created for when it might be best for you to get an antibody test.
And here it is. Go get your test 2 weeks after your symptoms, but don't wait any longer than 8 weeks because early research is showing your antibodies could be gone. Even with this new information, Dr. Coley says an antibody test is still a relevant tool.
You could potentially take your pain and turn it into someone else's life-saving therapy by donating your plasma for another individual. Now, the studies are still underway as to the efficacy of the convalescent plasma, whether it really works, but scientists are looking for donors in order to try to figure out that question.
It also helps track where the virus has been in the community. So while we wait for more research, the antibody conversation is still an important one to have. For Take Care, I'm Liz Kodalik.
You can get a low-cost antibody test at 9healthfair.org. You don't need a doctor's note, but you should schedule an appointment online. You can get your annual preventative screenings there as well.